How are you now looking to have people talk about their substance disorders? How are you handling cases that have affected you in the past where we've seen overdoses, deaths, according to internal company records and indeed according to interviews?
Well, first of all, thanks for having me. Just to give a little bit of context here, mental health is really broken in the US. If you look at the average wait times to find a psychiatrist, it ranges 2 to 3 months. And the vast majority of mental health professionals don't measure any quality outcomes whatsoever. And so the current system really is broken. Most counties in the country do not have a single psychiatrist. And so what we're doing with telehealth at Cerebral is to provide people with care within a couple of days, 2 to 3 days on average, and to measure clinical outcomes very, very carefully. We have a very robust program where we do screen for substance use disorders, just like brick and mortar clinics. And we have access to urine tox screens to make sure that we can verify that patients are getting the care that they need. And most importantly, we do have the outcome measures to show that the vast majority of our patients do much better clinically after just a few months with Cerebral.
The lessons you learned, the fact that you stopped prescribing controlled substances, Adderall, Ritalin, for example, after, of course, a grand jury did indeed subpoena from the US Attorney's Office, you received a grand jury subpoena. Are you starting to see changes? Do you think overall that you've learned lessons in terms of the way in which you prescribe and who prescribes?
So we stopped prescribing controlled substances because we've understood that the law, the Ryan-Haight Act that temporarily suspended the in-person requirement, will be coming back. And we wanted to responsibly be able to taper off our patients from those medications. We still do prescribe Suboxone for opioid use disorder, and that is a controlled substance because we heard that there may be an exception for Suboxone. So certainly I've been confident about our clinical programs, which are very robust and very clinically driven. We have clinical guidelines that are used by millions of doctors across the world as the North Star for our clinicians. And we have multiple support systems for our clinicians. For example, at any point within minutes, our clinicians can get in touch with a second opinion psychiatrist to run by a complex case. For example, we have unlimited visits for our patients when it comes to the prescribing. And we, again, measure these outcomes and give those data back to our clinicians so they can continue to provide good, high-quality care.
Thanks for joining us, David. You've been charting a new course as CEO since you took over that role in May. Of course, you were Chief Medical Officer for the company since February of 2021. A lot of the stuff we discuss in this story and other stories, be it concerns of nurse practitioners about prescribing of controlled substances and otherwise, you were not in the chief executive's chair, but you were the top medical officer for the company. As we look at some of the things that we talk about in this story and in previous stories, to what extent do you feel you bear responsibility for how things were managed during that period of time?
So again, I feel very confident in our clinical programs. When I came in, my mandate was to improve clinical quality and safety. And we set up some of the most robust clinical quality and safety teams of any telehealth company. For example, we have two dedicated teams, a clinical quality team and a clinical safety team, each run by a dedicated psychiatrist. And those teams have one mandate and one mandate only, which is to run quality efforts, run safety efforts. For example, we just launched a few months ago a suicide prevention program that basically proactively looks at the messages that we get from our patients. We get thousands of them every day, and some of them have suicidal content in them. Some of them say, I want to kill myself. I don't want to go on anymore. And we can detect that using machine learning and then proactively reach out to those patients within minutes, within 7 to 10 minutes. We don't care if it's 3 p.m. in the afternoon or that's 3 a.m. in the morning. This service is available to all of our patients 24/7, and certainly we don't charge them extra for that. It's just the right thing to do. So this is just one example of how we're using data science and machine learning to make care much safer and much better relative to the standard of care today.
David, when we talked to you in advance of our story, you said, of course, that due to patient privacy rules, you couldn't comment on any individual patient cases. I do hope you've been able to read the story. Is this the sort of care that patients coming to Cerebral should be expecting to receive, the sorts of cases outlined in Bloomberg's most recent reporting?
Caleb, I've been very confident in our clinical programs from the very beginning. I've referred my close friends who use the service, and they've had positive testimonials for this. It's something that we really believe is above the standard of care.
Ultimately, this is a high-growth startup environment that Cerebral was in. And do you think that that's ultimately the right environment for telehealth, particularly for mental telehealth provision overall, David?
Good question. I'll give you a story, and this is emblematic. It's a sample of something that we see all the time. We see this patient who I'll call Bill, and he received his therapy appointment, and his therapist saw that he was in his pickup truck by the side of the road, and his therapist asked, well, why are you in your car? And Bill said, well, I'm not ready to tell my wife and my kids that I have really bad depression, and I don't make enough money to have a private office to take a telehealth visit. So I need you guys to meet me where I am, because I'm sick and tired of meeting you doctors where you are. That's what we're doing. Our mission here is to democratize access to high-quality mental health care, and we're reaching populations that historically have been completely cut off from the mental health system. So it's not that if they don't have us, they'll go to their next psychiatrist. They don't have anything else. So we really want to be there for those populations, and that's my focus going forward.
David, you told us that Cerebral has been diverting some of its marketing spending to clinical care and other things that support the mental health process. Throughout 2021 and some of early 2022, a big part of Cerebral's marketing efforts was the gymnast Simone Biles, who, of course, brought mental health care to the forefront of her own story when she stopped competing in the Olympics. Is that partnership still active?
Yeah, we really support Simone, and I have to say that her contribution to mental health is immeasurable. And it really is very significant. And it's not just her, it's what she's been able to show our patients. Some patients come to us and they very directly attribute their reaching out to seek care because of Simone. And it's not just Simone, it's her mother as well, who has been very, very supportive. We're very, very appreciative of the partnership that we've had with them.
David, you tell that story, anecdotal story about Bill, and you say he couldn't have got care anywhere else. But there are competitors out there. And when we look at your numbers, looking at Bloomberg intelligence data, downloads of Cerebral have gone to 10,000 in October when they were up at about 78,000 in April. How do you recover from this? How do you recover your own valuation, for example, which I think we understand you slashed by about 95% on internal valuations?
So what I'll say is that we've made a conscious effort to decrease marketing so that we can grow sustainably. I'm very optimistic and confident in our business model going forward. The demand for high quality mental health care grossly outstrips the supply. And we're seeing very positive signals in terms of our partnerships with large insurance companies and primary care clinics and other ways to get patients the care they need.